6B41. Complex post-traumatic stress disorder. Disorders specifically associated with stress. Diagnostic requirements. Essential, required, features. Exposure to an event or series of events of an extremely threatening or horrific nature, most commonly prolonged or repetitive events from which escape is difficult or impossible. Such events include, but are not limited to, torture, concentration camps, slavery, genocide campaigns and other forms of organized violence, prolonged domestic violence, and repeated childhood sexual or physical abuse. Following the traumatic event, the development of all three core elements of post-traumatic stress disorder, lasting for at least several weeks. Re-experiencing the traumatic event after the traumatic event has occurred, in which the events is not just remembered but is experienced as occurring again in the here and now. For example, vivid intrusive memories or images, flashbacks, which can vary from mild, there is a transient sense of the event occurring again in the present, to severe, there is a complete loss of awareness of present surroundings, or repetitive dreams or nightmares that are thematically related to the traumatic events. Re-experiencing is typically accompanied by strong or overwhelming emotions, such as fear or horror, and strong physical sensations. Re-experiencing in the present can also involve feelings of being overwhelmed or immersed in the same intense emotions that were experienced during the traumatic event, without a prominent cognitive aspect, and may occur in response to reminders of the event. Reflecting on or ruminating about the events and remembering the feelings that one experienced at that time are not sufficient to meet the re-experiencing requirement. Deliberate avoidance of reminders likely to produce re-experiencing of the traumatic events. This may take the form either of active internal avoidance of thoughts and memories related to the events, or external avoidance of people, conversations, activities, or situations reminiscent of the events. In extreme cases, the person may change their environment, e.g., move house or change jobs, to avoid reminders. Persistent perceptions of heightened current threat, for example as indicated by hypervigilance or an enhanced startle reaction to stimuli such as unexpected noises. Hypervigilant persons constantly guard themselves against danger and feel themselves or others close to them to be under immediate threat either in specific situations or more generally. They may adopt new behaviors designed to ensure safety, not sitting with one's back to the door, repeated checking in vehicle's rear view mirror. In complex post-traumatic stress disorder, unlike in post-traumatic stress disorder, the startle reaction may in some cases be diminished rather than enhanced. 3. Severe and pervasive problems in affect regulation. 3. Examples include heightened emotional reactivity to minor stressors, violent outbursts, reckless or self-destructive behavior, dissociative symptoms when under stress, and emotional numbing, particularly the inability to experience pleasure or positive emotions. Persistent beliefs about oneself as diminished, defeated or worthless, accompanied by deep and pervasive feelings of shame, guilt or failure related to the stressor. For example, the individual may feel guilty about not having escaped from or succumbing to the adverse circumstance, or not having been able to prevent the suffering of others. Persistent difficulties in sustaining relationships and in feeling close to others. The person may consistently avoid, deride, or have little interest in relationships and social engagement more generally. Alternatively, there may be occasional intense relationships, but the person has difficulty sustaining them. The disturbance results in significant impairment in personal, family, social, educational, occupational, or other important areas of functioning. If functioning is maintained, it is only through significant additional effort. Additional clinical features: suicidal ideation and behavior, substance abuse, depressive symptoms, psychotic symptoms, and somatic complaints may be present. Boundary with normality, threshold. A history of exposure to a stressor of extreme and prolonged or repetitive nature from which escape is difficult or impossible does not in itself indicate the presence of complex post-traumatic stress disorder. Many people experience such stressors without developing any disorder. Rather, the presentation must meet all diagnostic requirements for the disorder. Course features: 1. The onset of complex post-traumatic stress disorder symptoms can occur across the lifespan, typically after exposure to chronic, repeated traumatic events and/or victimization that have continued for a period of months or years at a time. Symptoms of complex post-traumatic stress disorder are generally more severe and persistent in comparison to post-traumatic stress disorder. Exposure to repeated traumas, especially in early development, is associated with a greater risk of developing complex post-traumatic stress disorder rather than post-traumatic stress disorder. At the same time, other mental disorders can also develop following extremely stressful or traumatic experiences. Additional co-occurring diagnoses should only be made if the symptoms are not fully accounted for by complex post-traumatic stress disorder and all diagnostic requirements for each disorder are met. Culture-related features. 1. Cultural variation exists in the expression of symptoms of complex post-traumatic stress disorder. 1. For example, somatic or dissociative symptoms may be more prominent in certain groups attributable to cultural interpretations of the psychological, physiological, and spiritual etiology of these symptoms and of high levels of arousal. 2. Given the severe, prolonged, or recurrent nature of the traumatic events that precipitate complex post-traumatic stress disorder, collective suffering and the destruction of social bonds, networks and communities may present as a focal concern or as important related features of the disorder. 3. For migrant communities, especially refugees or asylum seekers, complex post-traumatic stress disorder may be exacerbated by acculturative stressors and the social environment in the host country. Thanks for watching.